Acanthosis nigricans. What is acanthosis nigricans? It is a disorder of the skin characterized by dark, thick, velvety skin and body folds and creases. Acanthosis nigricans, it can be found in body parts that are folded. It can be like axilla, front or back of the neck, flexors of the knee, and it may also be seen in umbilicus and groins. Okay, so what causes acanthosis nigricans? It can be divided in patients less than 40 years of age and patient more than 40 years of age, and some other common causes. In patient less than 40 years of age, most common cause is obesity. Obesity causes foldness of the skin, and in that part you can develop acanthosis nigricans. Apart from this, it can be due to insulin resistance, endocrine diseases such as Cushing's syndrome, acromegaly, hypo and hyperthyroidism, and polycystic ovarian syndrome. In patients more than 40 years of age, most common cause of acanthosis nigricans is carcinoma or malignancies. It may be carcinoma of the stomach or any other part of GIT. It can be bronchial carcinoma, it can be lymphoma, and in females, it can be specifically carcinoma of uterus, ovary, and breast. Some other causes of acanthosis nigricans is that it may be genetically inherited, or certain drugs can cause it, like human growth hormones, oral contraceptive drugs, steroids, fusidic acid. Apart from all these causes, acanthosis nigricans, it can happen in healthy humans as well. Acanthosis nigricans has three main types. Type 1 is acanthosis nigricans associated with malignancy. Type 2 is familial acanthosis nigricans. And type 3 is acanthosis nigricans associated with other diseases, for example, obesity, insulin resistance state, and endocrinopathies. Okay, so how do we get rid of acanthosis nigricans? First is the treatment of the primary cause as for any other disease. Second, reduction of the weight if the patient is obese, as for the same reason that it will cause the skin folding and all. Medically, topical applications such as etretinate, tretinoin, calcipotriol, urea, and salicylic acid. Apart from this, carbon dioxide, which will remove the thin layers of the skin with minimal damage. Then laser ablation and long pulse alexandrite laser therapy can be done.